you checked yes to fainting. What is that related to?
Usually just when like I have enough for like a long period of time, so let's say like now, like and I start not necessarily like thinking, but just
Okay, and then so this typically occurs like at dental appointments.
yeah. It happened the last time I went to the dentist, which was like 12 years ago. I think it was just because asked if I needed to go right or anything. They just left me there with my mouth open and I had the mouth problem. So it's just hard to like.
Okay. And then you checked yes to headaches, and those are frequent. Do you know what they arise from?
I think the majority of it just comes from like looking at a screen.
Okay. Makes sense. Is you're a student? So you do smoke and drink alcohol. How often do you drink alcohol?
Like special occasions, really.
Okay.
I wouldn't say more than like 2 to 3 times a month.
Okay, a couple times a month.
Yeah.
And then smoking?
It's the same. I mean, a lot more than like drinking. Maybe a couple times a week, but
Okay. And then you were hospitalized for an appendix leakage?
yeah, that was years ago though.
Like how long ago?
I want to say like 6 years ago.
Okay. And then were you kept? Like because you were hospitalized?
Yeah, I think it was like 2 days.
Okay. And then did they take out your
Yeah.
Okay. And then also hospitalized for panic/anxiety attacks. Talk to me about that a little bit.
Yeah, the last time that I was hospitalized for that was almost a year ago.
Okay.
And it wasn't an overnight stay, it was kind of just a couple hours.
Oh, okay. And how often do these happen?
Those are kind of frequent. I want to say like a couple times a week, and if not, maybe like quite a bit each month.
Okay. Do you know kind of what they arise from?
Yeah, I've kind of like gotten this sense of it a little and kind of gotten the hang of like controlling it myself, but at times it's a little extreme, so I do have to kind of like
Just go to the hospital
Yeah.
for it? Do you take medications for that?
not now. I used to.
Oh, okay. Yeah, no medications. So, after having done my patient interview with this patient, I do realize that the video is a little bit loud as there is other people in clinic, but as you can tell, she had quite a little bit of history going on with fainting and seizures, and just anxiety. So I feel like overall I did a really good job of keeping her comfortable and not asking questions that she wouldn't want to answer or that were a little bit too personal. So I feel like something that is really important when it comes to patients like this is the tone of voice that you use. If you use like a tone of voice that is very like monotone and kind of like not really caring, the patient is not going to be really comfortable answering these questions, or forced, or they're just not going to answer correctly just because they don't feel like you care. So I feel like caring is a very big deal when it comes to asking questions about their history, as some of it could be a little bit sensitive for them to talk about, especially to a stranger. Another thing, I also keeping that eye contact, like I mentioned, and nodding my head, I think was a big impact in this interview. It was the nodding my head and listening and not talking over her. I always made sure she was finished answering the question before I asked a different question or asked her another thing about that. So just keeping that eye contact here and there and nodding your head. Especially since you wear the mask, I feel, well, at the time we had to wear N95 still, so the patient wasn't able to see our reaction. So I feel like eye contact and nodding your head is a very good way to let them know that you are listening and you're there for them. So overall, I believe I did a really good job with interviewing this patient. I made sure to ask her questions like the onset of the fainting, or if she knows what it arises from, when does it usually happen, how often, and when was the last time this happened. And I asked that for everything that she checked yes to. There were some questions that were specific to the things that she checked yes to in her history that I would ask. And yeah, overall, I think I did a